Welcome to CTJ News at 8, where a patient is given his only chance to live. We have been following one specific patient since the first day we met him and his prognosis. For the first time ever, here with the story is Jack, Chris, and Tom.
Glioblastoma?
Yeah, glioblastoma.
Uh-oh, who's gonna tell him?
I nominate Pretty.
Oh, okay, he isn't gonna take it very well.
Hello, Mr. Lockridge. Please come with us for your checkup.
Okay, I'm just gonna cut to the chase with you, Mr. Lockridge. Your test results show you have glioblastoma.
What's that?
Well,
Glioblastoma are tumors that arise from astrocytes, the star-shaped cells that make up the glue-like or supportive tissue of the brain.
These tumors are usually highly malignant because the cells reproduce quickly and they are supported by a large network of blood vessels.
And?
the outlook is bleak.
There is, however, a recent study where some cases of glioblastoma, like yours, were cured by dripping the polio virus into your tumor.
However, this is only in its first phase of testing and very risky. But for those who are given a death sentence, it is their only hope.
Would you consent to participating in these test trials?
Okay. So basically, what this test entails is that we will infect the tumor with polio.
This will deteriorate the protective coating of the cancer cells, and your immune system will take care of the rest of the cancer cells.
So far, there have been 22 patients in the polio trial. 11 have died. Most of them, however, had the higher dose, but even so, they lived months longer than they expected. The other 11 continued to improve.
These tests therefore mean there's a greater chance of survival for both you and patients like you in the future.
And after this quick break, we'll resume with this thrilling documentary. And we're back.
Let's follow Mr. Lockridge throughout his first cancer treatment where they inject polio virus into his tumor.
How has Mr. Lockridge's treatment been going?
He is the first patient to show significant progress within the first 2 weeks of treatment.
He had his first checkup yesterday and has shown a 5% decrease in tumor size.
That's quite a lot.
We expect him to be cancer-free within 2 years.
This will be the 23rd recipient in this test, but only the 12th to survive with the dose we gave him.
Under this test now, will the treatment be available worldwide?
The results are still not conclusive enough to send it out to the public. We will need to test more patients in order to go forward.
So, thank you, Dr. Preddy, Jacobs, and Donovan, for taking time out of your schedule to inform the public about how you are making cancer a less daunting disease. Thanks for tuning in this week to CTJ News. We'll see you next week.
Glioblastoma are tumors that arise from astrocytes, the star-shaped cells.
These tumors are usually highly malignant.
Swag.
Say! Say! Thanks for tuning in this week to CTJ News.